Now we're going to see the drugs that are used in Parkinson's disease. So here we have dopamine. Dopamine can be converted in the central nervous system into 3-methoxytyramine by the catechol or methyl transferase enzyme, and in the peripheral nervous system could be converted to 3-O-methyl-dopa by the same enzyme. Dopamine also can be converted to 3,4-dihydroxyphenylacetic acid by the MAO-B, this is monoamine oxidase B enzyme. And here we have dopa that is converted into dopamine. So we can have drugs that increases the availability of dopamine by preventing that dopamine be degraded by these 3 enzymes or 2 enzymes. So these would be the inhibitors of MAO-B. These are selegiline and rastagilin. The adverse effects of these would be just nausea, most of the times insomnia and confusion, more the insomnia and confusion. So when we block the conversion of dopamine to 3,4-dihydroxyphenylacetic acid, we have more dopamine for the central nervous system. The other is the inhibitors of the COMT, catechol or methyltransferase inhibitors. These are entacapone and tolcapone. Both can decrease the dopamine conversion to 3-O-methyl-dopa, so they both block the catechol or methyltransferase in the peripheral nervous system, and only tolcapone can block the catechol or methyltransferase enzyme on the central nervous system, so prevents the conversion of dopamine to 3-methoxytyramine. These drugs are never given alone, but they increase the dopamine availability and so can decrease the need of give direct agonist for dopamine. The other is we don't give dopamine to the patient because dopamine cannot cross the blood-brain barrier, that is where we want that dopamine be. So we give dopa, and dopa is going to be converted into dopamine. So the direct medications here would be levodopa. Now levodopa will go to the receptors here of dopamine, and levodopa will be converted to dopamine, and then dopamine will go to the receptors. The other issue is that we will give carbidopa because we want to prevent the conversion of dopa to or the degradation to other things. So for that we give levodopa carbidopa. Levodopa is the agonist of, or is like giving dopa that will then be converted to dopamine, but carbidopa is to block the conversion of dopa to other things. And lastly we have the direct drugs acting here on the dopamine receptors, so are the agonists of dopamine. These are tromipenrol and pramipexole. Also we can have gabergolin or bromocriptine that are used more for a prolactinoma. Here we have these two, and they act as a dopamine agonist. Here the adverse effects include hallucination, confusion, nausea, vomiting, postural hypotension, and gambling. The patient takes risk situations, and one of the most common is gambling into the Vegas or wherever. And for levodopa and carbidopa, they can also have confusion, nausea, vomiting. The most common would be nausea and vomiting, but this is because of the peripheral nervous system metabolism of dopa. So also when we give carbidopa, we decrease these adverse effects of giving levodopa. And here we will see something called the on-off phenomenon. Here the patient suddenly becomes, for example, immobile, and then can walk again, and then immobile. So here we see a lot of fluctuations giving this levodopa and carbidopa. So when we give other drug, for example, selegiline, that will increase the availability of dopamine, we will decrease the levels of levodopa that we will give the patient, and so we will see less fluctuations on the movement of the patient. And the other is amantadine. Amantadine increases the release of dopamine and decreases the reuptake of dopamine. Amantadine adverse effects will include libido reticularis, that is the vasodilation of some blood vessels. There will be, for example, some clot formations on the capillaries, and we will see that dilation. And at the end, if the patient has these adverse effects for chronic or long term, we would see the vasodilation of the venous dilation that leads to stasis of the venous system, and also the telangiectasias. So we have those that block enzymes, those that act on the receptors, and the main effect is to increase dopamine, either by decreasing the breakdown or by increasing the conversion, here giving levodopa that would be converted to